When we were young, one of the danger areas in our house, very uniquely, was the refrigerator. Because there was a shelf in it that had small circular glass sample cases with small specks inside. And every once in a while we would wonder what it was. I'm not sure how one explains to a large public audience that some of us grew up with varieties of stool samples in our refrigerator. But when the research for this vaccine was going on, the electricity at the All India Institute of Medical Sciences was like the electricity in India in most of the 1990s. And every once in a while, if the lab didn't work, he just put them in his bag and brought them home. So Mom had a very efficient reach out shriek when it opened and our hands went and said, "That's not the food." But growing up like that was made all worth it by the vaccine that came in the end. And one of the people who became family to us, one of Dad's closest collaborators in developing that vaccine, was Dr. Roger Glass.
Wow. I'm so thrilled to be here. As a member of the Bhan family. And I feel like I've been in this family now for 35 years. I think one of the most enduring accomplishments, Can you hear me? One of the most enduring accomplishments of Dr. Bhan's career has been his involvement with the development of the rotavirus vaccine. And I want to tell you a little bit about that story. I met Dr. Bhan in 1985 in Calcutta. We were attending a WHO conference on childhood diarrhea, and we were lodged in a convent. Now, there are not many pubs in a convent, so we had to go out for a drink and share our thoughts. He was puzzled that newborns in Dr. Vinod Paul's newborn unit had rotavirus but did not have diarrhea, and he didn't know why. And I was at NIH, and we had the same problem. We had children in 4 countries with asymptomatic infections, and we didn't know why, but we learned that it was an unusual strain. And together, the two of us decided we would figure this out. So we began working together. No funds, no grants, just youthful excitement to see what we could find. Dr. Bhan's inquisitiveness, his kindness, his willingness to share really brought us together. His humor, his friendship kept us together, and his ability to work within the Indian system kept our project on target for 35 years until it became a success. We became chuddy buddies. I've gotten to know his family, not just the relatives, the extended family, and I appreciate all of you. But the family also of students he mentored, many of whom are in the audience today. My own love of India is perhaps a reflection of this love for this entire extended family, and I see you all out there. Translating research on a virus to making a vaccine is not done by 2 people. It takes a team. And research by our trainees at Ames and at CDC found the secrets that children infected with this virus in the newborn unit were protected against subsequent disease, a basic finding. And that's where we began. In 1987, we became part of a new Indo-US Vaccine Action Program, the VAP, hosted by NIH and DBT. Dr. Harry Greenberg at Stanford joined the program with his own candidate vaccine and provided real vaccine development experience. And we went on to make a pilot lot of vaccine. Then in 1998, the VAP hosted a meeting in Bangalore to find a commercial partner. Dr. Krishna Ella, who's in the audience, showed up and stepped forward and said, "I can make the vaccine." We looked at Dr. Ella. He had never made a vaccine. He had never worked with viruses. We said, "Can this guy do anything?" Boy, were we wrong. He was absolutely incredible. And we went on from there. The Gates Foundation gave us money to start the project along with DBT, and Dr. Ella's group actually made the vaccine. They did something more. They agreed to provide the vaccine for $1 a dose, when the vaccine in the United States cost $60 to $100 a dose, something that was affordable here in India. Then Dr. Nita Bhandari stepped forward, one of Raj's trainees, and set up a clinical trial at SAS and performed the magic of clinical trials of 7,000 children. She only lost 2% of those children in 2 years of follow-up. She was amazing. In February 6, 2013, was one of the most dramatic days of our lives. The code for the trial was to be broken and represented 14 years of work by hundreds of people. It all rested in the balance. We waited outside the door of a closed room like expectant fathers while the data monitoring group reviewed every detail of the trial. Finally, Madhu Santosham, head of the DSMB, opened the door. He revealed the results, and we burst into ecstasy that the vaccine had been successful and applause. It had worked. It was amazing. We immediately went back to the pub for triumphant jubilation and celebration. The results were soon published in Lancet with a companion article by us about the value of team science. Not two people, but a team. Well, on March 9th, 2015, I rushed to Delhi to be present when Prime Minister Modi and Secretary Harshvardan and others joined Dr. Ella to launch Rotovac, the first totally new vaccine developed entirely in India with an Indian strain, an Indian company, Indian clinical trials, and the government of India's support. It was truly an Indian product. Along the way, we had trained dozens of young researchers. Bharat grew up to become a mature vaccine company. SAS became a major contract research organization, and India has become an even greater supplier of vaccines for the world. Dr. Bhan's vision and energy sustained the momentum of this enterprise. He opened doors, removed obstacles, and encouraged us at every step. 2 months ago, I was back in India to visit Dr. Bhan in the hospital. But at that time, we celebrated the delivery of 100 million doses of rotavirus vaccines in India. And we learned that that immunization program will cover all Indian children with vaccine by the end of this year, 2020. The vaccine's now being distributed by UNICEF. It's in many countries. And the disease rotavirus still kills some 200,000 children each year. For India, we estimate that these vaccines have already saved more than 50,000 lives and several 100,000 hospitalizations for diarrhea. It's really been a godsend. Well, certainly lots of people have been involved in this effort, on this success story. But Dr. Bhan was really the heart and soul of this effort and counseled us at every step. His legacy will be measured in India every single day by the hundreds of diarrheal deaths saved by these vaccines and thousands of hospitalizations prevented by rotavirus. What greater achievement, what greater accomplishment could a pediatrician ask for? And Dr. Bhan not only has done that, but he's left us a cohort of young researchers, many of you are here, who will continue the fight to improve child survival worldwide through research. It should be evident that my research with Dr. Bhan, my chooty buddy, has been a highlight of my professional career. We have done so much together. I've learned so much, We've shared our families. We've gone to Kashmir together. It's been a love affair for 35 years. While we all grieve his loss today, we're all lucky to have shared his passion, his wisdom, his vision, and his friendship. Thank you, Raj, for all you have given to so many of us here for so long and beyond. Your legacy from the rotavirus vaccine program and the people you've influenced along the way will be with us for years to come. Thank you so much, and thanks to all the family. I feel part of this whole group.